states to kind of see what was going on out there and use some very scientific methods to kind of define the problem. In 1992, we see the Center on Hunger and Poverty, and we see many of the same results. We see the additions to many of these programs with elderly housing, nutrition, school lunch program as well as some of these efforts. But the big effort, and the thing that helps us and to kind of situates us right now, is the Federal Food Security Module in 1995. And what this is an attempt at a standard measure to evaluate the extent of hunger on an annual basis in the United States. It is done annually by the Census Bureau, and these are the numbers that we used in this study to identify who's hungry. So that history wasn't a very good one, that history lesson, but it gives us a little bit of a grounding in kind of where we're coming from here, at least on the federal level. So during annual census tracking, the Census Bureau asked a set of 18 questions that were developed by the Department of Agriculture. And the goal is to determine the adequacy of people's diets. And a sample of 3 questions are: do you have enough food to feed your families? Do you skip meals because of insufficient income? And how often do you put your children to bed when they're hungry? Chronicity is also assessed in this measure. These questions are asked using a broad national sample of households. And again, the specific goal is to determine the adequacy of a diet. Now, this is where we start to kind of wonder about how do we define hunger. And previous to this, the federal definition was more of a painful sensation. So the definition would be a painful sensation in the stomach. And what this reflects, though, is a high degree of food deprivation. It doesn't necessarily capture the notion of food insecurity. So what food insecurity might include is kind of not knowing where your next meal is coming from. Again, putting your children to bed hungry, going to bed hungry, being hungry. And the impact of food insecurity is significant as well. It's not just hunger that leads to some of these adverse outcomes. It's also food insecurity. When you look at these numbers, what you see is, and this is a sampling of 3 years, is about 11% of households are hungry or food insecure, and about 12% of individuals, which is about 35 million people. So we chose to use this number. So again, the first thing we want to know is the extent of the problem, the definition of the problem. We chose to use the definition of food insecurity and hunger, and we chose to use the federal government's number of 35 million people. Why? 2 reasons. The main one is that this is in the scholarship that you see out there, in the studies of which I spoke earlier about how do we identify the adverse outcomes of hunger, they're using this number, they're using these definitions. The second thing is that we feel like food insecurity and hunger, especially based on the scholarship, does kind of accurately represent the adverse outcomes that we've identified. What we know is that people with food insecurity, for example, are sick more often, miss school more often. Children that live in food-secure households, whether or not they're experiencing a painful sensation as defined by hunger, are sick more frequently, miss more school, and do poorly in school more often. So kind of based on that initial kind of look at the literature or kind of breakdown of things, we find that this definition of food insecurity versus hunger and this number work the best for us in this study. Charities have played an immediate role in kind of mitigating the effects of hunger. This is in the form of soup kitchens. Second Harvest is one of the biggest organizations out there that distributes food and food banks and food rescue and stuff like that. And charity comes with a cost. And the nature of charity is a typical donation. So a person's hungry, you give them food. But the soup itself, or the hours worked by people in these particular organizations, doesn't come free. There's a cost to that. There's a cost to society. Somewhere along the line, somebody pays for it. The act of people have to volunteer time, and with each of these, we see the total cost of charity. So we see food banks, local feeding programs, volunteer support, other feeding programs, and unaffiliated local programs. These are the costs. These are the costs to society of short-term, maybe very small-term interventions to deal with hunger. One of the ways we might understand this, and one of the ways we might want to think about this, is that when we think about volunteers. Volunteers are volunteering to work in various food bank organizations. What's the cost of the time of that volunteer time? And another way to think about that is, what else could they be doing? Right? There's a cost right there. It's not that dealing with hunger is not a great thing, it's a very important thing, but those efforts and that could be used somewhere else and doing something else. And that's how we kind of come up with this overall cost. And you might argue that, you know, the cost of, you have to buy the cost of food somehow, right? Yeah.
How about in this whole scenario, what about churches, religious groups that are feeding the hungry, but you're not aware of it?
Right. And we try to capture that in here. We try to capture that. That's excellent. So what we had to do with this is kind of we identify what is the literature that shows, you know, it's not just Second Harvest. That's one of the biggest, and that's one of the things that we identified. But there are other groups that are also doing things. And there are people that are doing things that aren't captured by this. Yeah. Right? And so that's what we try to do with kind of other national feeding programs, unaffiliated local programs as an example of a church. Now that said, we had to be very careful. We wanted to make sure that our numbers were conservative. We didn't want to go too wild on this. So we only wanted to identify costs for which we were able to identify studies. Okay.
Did you include the cost of transporting, whether it's the food or the people food?
These are overall costs for all of them.
Volunteers spend a lot of time driving.
That's right. That's another good cost. That's great. Right. Let me go through I have to say that I am the health person, so I'm very comfortable with this chapter. That's my area, is cost around healthcare and mental health care. And that's why I worked on this project, as well as my interest in hunger, don't get me wrong. But so, when we look at the cost of illness and the cost of mental illness, mental health and medical care, the first step is identifying research studies, right, that show consequences for the initial problem under study. And what we were able to identify were studies that showed these particular consequences, as well as the next slide, consequences for psychosocial issues, right? So what we see are, for example, there's actually an actual study that's in the report that you can find that says that people that experience food insecurity are 1.66 times more likely to have iron deficiency and anemia. Okay? Frequent headaches, 1.92 times more likely. And there are other outcomes you might come up with here. An example is obesity. One of the ironies of food insecurity is that people that are food insecure are more likely to be obese. What we did not do in this study was we could not find solid research. We could not find a study. We know that. We seem to know that at least. We could not find a study that we felt like met that kind of conservative. That's why this is a very conservative number. This is the lowball number, $90 billion. So there are probably several other medical outcomes that you could come up with here. Right? So the first step, we've identified how we're going to define food insecurity. Now we're going through the literature to identify all the potential medical and mental health consequences of hunger, food insecurity. The next thing we do is we identify cost studies. So we identify studies. So we might say, oh, that's really nice that people are more likely to have withdrawn behavior if they're hungry. What's the cost of withdrawn behavior, though? How do we measure that? You know, I mean, you can argue that some people that have withdrawn behavior become physicists, right? Go on to make major contributions. I don't mean to stereotype, of course, but you can't really say that there's a cost to withdrawn behavior, right? The same thing with psychosocial dysfunction. So we have a nice little study here that defines psychosocial dysfunction in a certain way, which we hope is based on the literature. But is there any study out there that now shows, okay, well, the cost of psychosocial dysfunction is?